TikTok has taken over the world. Let's go. Dental hygiene hack. What are you doing?
The toilet water is actually a great alternative to toothpaste because of its strong chemical properties. That's why I dip mine in there.
No, no, no. Jonathan, get off TikTok.
You know, waiting for a good day to happen, you know? Waiting around, well.
Dentistry is such an intimate and personal experience. I know this is a joke, but when someone comes into your comfort zone, that safe place of yours, this private area, and then, you know, it's someone that's sweet and nice, you could pick up the wrong signals.
You guys, first have your digital sensor and bring tip prepared.
This is, there's different levels of gaggers, right? What she's showing is someone that gags every time you take an intraoral x-ray.
To avoid this, your patient lift their feet in the air.
Lift the feet.
Okay, open wide. Bite down.
So one technique that she uses is to raise the feet. This is a distraction method. I've tried it. What really, really works for me, but this is just me, is the way that I speak and communicate to my patient. It's about calming their fear, and you have to get to the bottom of it.
Fixing the gap in my teeth with $5 clear rubber bands. These are the bands that I use.
This is completely misleading. It's not just about closing the space and putting pressure. First of all, you don't even know how much pressure you're applying to your teeth. So if you don't do it correctly, A, you could loosen up your teeth, and B, you could cause irreversible damage. So maybe it will move. The problem is, the second you remove those rubber bands, they're gonna move right back into position. Worst foods for teeth. Mountain Dew, a lot of acid, a lot of sugar. Both of those together especially could destroy your enamel. Goldfish, maybe because it gets stuck on the back of the crevices of your teeth, possibly. Energy drinks, for sure, high in acid. And again, acid can erode your enamel, and enamel is something that you cannot regrow. Swish with salt and water. Many times we recommend rinse your mouth with warm salt water if you have anything with the gums related, because salt water can actually reduce some inflammation. Putting on cold compress, if there's some swelling or some pain, the cold could alleviate some of that discomfort. That one I don't know about, so if that's something that you're into, I know for sure it's gonna cause you some bad breath. So what is she doing? She's putting toothpaste on her finger. If you guys put toothpaste on your finger, make sure your hands are washed and they're super clean. So let's see what else she's doing.
In your life, I'll go first.
That is a great idea. I actually like that very much. I did recommend that in the past to several patients. Definitely a good idea. Try it out. Let me know what you guys think.
Every time I go to the dentist is like, you need a MOD, a buckle that, a root canal this, a new.
Basically what she's saying is like when a patient goes to a dentist and then the dentist starts to like spit out all these dental terminologies, MOD, RCT, LOL, be right back, BRB. Those are the things that really could cause a patient not to come back to the dentist because all this terminology, it's overwhelming.
Dental tips, number 1. It is always better to floss your teeth before brushing them. Because when you floss your teeth, you're gonna break the bacteria between your teeth. And then when you brush with a toothpaste that has fluoride in it, you will add that fluoride between your teeth and help them stay healthy.
I honestly brush my teeth first. I wanna make sure that I could clean around the margins, around the gums. As long as you're doing all three things, dental hacks that are surprisingly true. Early decay can be reversed with fluoride. So cavity could be small or big. So when the cavity is small, it's called an incipient lesion and it's within the enamel. You don't need to drill the enamel. Chewing sugar-free gum helps to prevent decay. One part of chewing sugar-free gum is that it stimulates saliva, and saliva buffers acid. Acid is what causes you to have tooth decay.
After that nice 2-minute brush, you're probably going to rinse out with some water. Instead, spit that toothpaste out. When you rinse, you're taking away all that fluoride that's protecting your teeth.
If you're using a fluoride-based toothpaste, the idea is let it sit and marinate on your enamel for it to have the full effect. Now let's see what it is. So it looks like this person is doing it yourself toothbrush and is adding toothpaste to it. It's making a toothbrush. It's very creative. There's a possibility that that toothpaste that you put inside your syringe, it could dry out. Let's see what this gentleman is doing as an alternative. This might be an easier approach for you, less of a headache, and also he might be adding a little bit too much toothpaste. All you need is a pea size of toothpaste for it to actually work.
So 3 dental tips. First, electric toothbrushes are always better than a manual toothbrush.
I agree only if you guys know how to use both of them correctly. The problem is, if you don't know how to use an electric toothbrush correctly, it's not effective and it's just as bad as using a manual toothbrush incorrectly.
2 is that your toothpaste, it really just doesn't matter what toothpaste you get, but stay away from the bleaching toothpaste and the tartar-controlled toothpaste.
In reality, you don't even need toothpaste. The idea of brushing your teeth is to remove the tar buildup on your teeth and by the gum line. So as long as you use water, it's fine. Especially, we're here located in New York. New York has fluoridated water, so under the sink, add some of that water and you brush your teeth, you'll be fine. Some parts of the country and some parts of the world, they don't have fluoridated water, so the toothpaste comes with fluoride, it comes with other ingredients that will help soothe your gums if you have other problems.
And third, flossing, it's kind of out. Don't floss, use a water pick.
I don't agree with you, doctor. I believe that you need both of them. Flossing, the proper flossing technique cannot be replaced. It could only be added with the water pick, so do both.
You need to start scraping your tongue.
So the tongue has like these little hairs on it. It has these little grooves in it. Both of these things carry so much bacteria and bad breath. So for those that are just brushing and flossing their teeth, it's not enough. If you want to get rid of bad breath, you have to clean and brush your tongue.
Brush your teeth before or after breakfast. If you're looking at protecting your teeth enamel, brushing before breakfast is better. If you have to brush your teeth after breakfast, do it after 30 minutes or 1 hour.
I would recommend you brush your teeth as soon as you wake up, remove all that bacteria that's been marinating in your mouth. But he's saying that if you do brush your teeth after breakfast, wait at least 30 minutes to an hour, because many times the acidity in your mouth, if you brush your teeth right away, it could cause scratches in your enamel. Tips from a dental assistant. Shout out to all the dental assistants. You guys work your butt off. We love you. We appreciate you.
Diluting juice does nothing. It literally does nothing. You'd be better off allowing your child to drink juice and drink.
Diluting juice does nothing. That's true because the sugar is still there. The acid is still there. So it looks like she's applying a type of tooth-colored filling material called composite. That light actually turns that soft material into a hard material, which is then looks like and feels like enamel. And she did a great job closing that space and creating that illusion that this patient never had a gap. Did you guys enjoy that? Because I know I did. If you have any other TikTok videos that you want to send me and you want me to react to them, send it over. You can either send it through DM, email me, or even comment below the link and I'll click it, I'll watch it, and I'll give you my reaction. I love you guys so much. Dr. Daniel, out.